Hello everyone, my name is Nelson and I'm going to be talking to you about the health system of Missouri, the state. So as everybody knows, in 2010, I believe March 23rd, the Affordable Care Act, which is Obamacare, was designed and actually put into law, and it wanted to ensure that all Americans had health coverage. That's like the gist of it. So individual states have some latitude as to Obamacare, how they want to implement the intentions of Obamacare. So it's not foolproof by any means, but statistically it has helped move in the direction that it was originally aiming for. So some of the things that Obamacare set out to do was to reduce the number of uninsured Americans. So about 16.4 million uninsured people gained health insurance coverage, which is the largest reduction in about 4 decades. It went from 15.2 to 13.4% between 2014 and 2013, so that year. There was new coverage options for young adults, so basically the age cap got moved up to 26, so if your parents' healthcare policy included child insurance, basically you'd be covered up to 26 now, which actually helped over 2.3 million young Americans. So it was really good. And then it did other things like expand Medicaid, so states had the opportunity to expand Medicaid coverage to individuals with family incomes at or below 133% of the poverty line, which comes out to about $32,000 for a family of 4 in 2015. So this expansion includes non-elderly adults without dependent children who have not previously been eligible for Medicaid in most states, so that's really nice. Because people without any insurance aren't going to go to the hospital or see their doctor, so that actually ends up costing the government more money. So actually 30 states plus DC have expanded Medicaid under the Obamacare or the Affordable Care Act, but Missouri has not expanded Medicaid. And as of January 2015, only 17,500 Missourians have gained Medicaid or CHIP, which is the child care health insurance plan coverage. And since the beginning of it opened up. So in Missouri, expanded Medicaid. Sorry, let me recap here. So other things that were actually good for the Missourians, as they're called, would be the 80-20 rule that was implemented. So basically 80 cents per dollar of the healthcare payers or the American people's premium has to be put into their healthcare or improvements to the healthcare, and only up to 20% is allowed for administrative costs such as marketing or salaries, which is really nice. So you know you're actually getting your money's worth in a sense. The Obamacare ACA made it so insurance companies had to justify any kind of premium increases of 10% or greater, so that's really good for the American people because you're not just going to be getting premium raises for no reason. So, and if they want to raise it, they have to justify it. So actually in the years just in the past year, it went from 75% down to 14% when it came to how many companies wanted to increase over 10% in their premiums. So you can see clearly probably the other 60% were just kind of like increasing just because they could. So they didn't want to deal with the problems of actually having to explain or justify why. Lifetime limits for people who have like cancer or any kind of chronic health conditions, those caps were removed. So their lifetime limits, they didn't have to worry about that, so it's kind of like worry-free. You don't have to say, oh, I have this disease and I'm going to run out of my money, and then what am I going to do in my later years? Now it's like, okay, we're going to cover you. And other things were, and if you had a pre-existing condition, they couldn't just, discriminate against you. And on top of that, Missouri was charging females more just for the gender, so that's actually illegal now as well. And these are a lot of statistics, so I'm actually not going to go more into detail with all these statistics. I can link it if you guys would like, if you want to really look up into it. But I will tell you this, the Obamacare in Missouri has led to better options, better value, better health, and a stronger Medicare program. And some of the ways that they have implemented these would be by implementing the covering of preventative services with no deductible or copay. And the more preventive services that are performed leads to better outcomes for patients and actually decrease stress on the healthcare system as a whole. And other ways that include investing in the primary care workforce, what they're doing with that money, increasing support for community health centers, and actually cracking down on abuse and fraud. So overall, Missouri has benefited from all these, from Obamacare in general, and the money that has been funded. Is, like I said before, less premium payments, less fraud, less money just going to people's salaries, and actually more money to the people, and their premiums are being used for the people. So that's great. So thank you guys for listening.